discussing trach care and trach suctioning. So to begin with, we're going to talk about suctioning. Your patient should be in semi-fowler position with a linen saver pad on their chest. And then you're going to test your suction container. So you're going to put your gloves on after having washed your hands, and then you'll get your tubing and you'll occlude the suction, make sure it works. Suction should be 50 to 95 for infants, 100 to 120 for children, and 100 to 150 for adults. Once you've done that, you'll come get your suction catheter kit. You're gonna open it up, get your sterile gloves, put them on the bedside table. You come back over here. This wouldn't already be here, but for the purpose of this video, it is. So you're gonna grab it with your non-dominant hand, and you're gonna wrap this part in your dominant hand. And then you would let go. You would get your saline, pour it in your container, and grab this back, the suction, and you're going to lube up the catheter by occluding the suction. And then you're going to come over here and you're going to insert it the pre-measured length, no deeper than 15 centimeters. So you're not going to include the suction here when you go down, but when you come up, you do. And you go in a circular motion, you're keeping this arm up, and you're gonna limit the suctioning to 15 seconds each time you suction, with 30-second intervals in between. And you're gonna keep that procedure under 5 minutes if possible. And you can do that suctioning up to 3 times. And then you're going to, you also listen to their lung sounds before the procedure, so you can assess them afterwards to see improvement. So that is suctioning. And you would put them in a comfortable position after you're done. And that is suctioning. I would also like to note that when you're doing trach suctioning, you would hyperoxygenate your patient as necessary during the procedure. And you would also note the color, consistency, amount, and odor of your secretions afterward, and then dispose of them according to agency policy. Now I'll be moving on to trach care. So I would get my sterile kit here. Get my gloves, and this will serve as my sterile shield after my gloves are on. And then I'm going to take out my supplies, put them on my field. And then I'm going to pour my liquids into my compartments. So I have peroxide, which I'll pour into this container over here, halfway. And then I'll get my saline, and I pour that into that compartment the rest of the way. And then I come to this one, fill this one up with saline, and then my large compartment with saline. Okay, so to begin, I'm going to put half of my gauze into this large compartment over here. That's my wet gauze. Put this one over there as well. And then I have my pipe cleaners, those can stay dry. My cotton swabs can go in this other compartment of saline. And then my pipe cleaner, my nylon brush can come here. Be careful to have your supplies facing inside the kit, not outside, or you'd be breaking the sterile field. Okay, so I'm going to remove the soil dressing with my non-dominant hand, and then I'm going to remove the inner cannula of the trach with my non-dominant hand. Careful just to touch the outside at the top, and then I'm going to bring it over here to this compartment of the 50-50, and I'll take my nylon brush. I'm going to scrub the outside, and then scrub down inside. And I'm going to take it over here to the normal saline and tap that in there, and then I'm going to get my pipe cleaner. I'm going to scrub the outside, getting excess peroxide off of the cannula. Throw that away, get a new one, and go inside. Throw it away. Then I'm going to carefully insert it back in towards the curvature and lock it in place. Then I can remove the soil dressing. So I remove that, and then I'll get my cotton swab. The sterile part is now over, so I'm just going to do a swipe around the stoma here, throw that away, get a new one, come over to the other side, and then you can get under the stoma at the bottom. Then I'm going to take my wet gauze. I'm going to just wipe it, getting a new one. And then I would take my dry gauze. I'm going to dry it off. I'm going to dab it. You would never use cotton because it can get caught in the trach. And then I'm going to take my new dry dressing. I'm going to wrap it up underneath of the faceplate. Then I would get my trach ties. I'm going to hold this in place. I could get another nurse to assist me if I needed to. So I'm going to untie this side of the old trach ties, or they could be Velcro. And then I'm going to tie the new one into this side, holding this in place so you don't want it to come unsecure. Bring this around, untie the other side, and insert the new, and then tie it. And then you're going to dispose of your materials. Wash your hands, make sure your patient is comfortable, and then you put on new gloves and you provide the patient work care.